All agreed?
Agreed.
All agreed.
First of all, I am pleased to move and have this opportunity to address the House on the second stage of the Health Insurance Amendment Bill 2018. The bill was published on the 14th November and, as deputies will be aware, concluded its passage through the Seanad last week. I welcome the support received in that House for the core principle of community rating, which is long established and well-supported government policy for the health insurance market. This is a short and technical bill comprising 8 sections, all focused on the specific issue of health insurance. The amendments outlined in the bill will ensure that the ongoing sustainability of the private health insurance market and seek to keep health insurance policies at an affordable price for all citizens, young or old or sick or healthy. Health insurance in Ireland is provided according to 4 principles: open enrolment, lifetime cover, minimum benefit and community rating. Open enrolment means that insurers in Ireland cannot refuse to provide cover to someone who might be a risky customer for them, and there are maximum waiting periods for pre-existing conditions. Lifetime cover means that once a person has health insurance, the insurer cannot stop cover or refuse to renew their insurance, except in very limited circumstances, such as fraud. Minimum benefit means that all insurance contracts must abide by regulations to make sure that everyone who holds health insurance has a minimum level of cover. Perhaps the most important principle of health insurance in Ireland, and the principle which is the central focus of the health insurance bill each year, is community rating. This has the greatest effect on affordability of health insurance for those who are most likely to need health insurance coverage. Community rating means that health insurers cannot alter their prices based on an individual's current or potential health status. Instead, insurers set the price for each product according to their overall expected claims costs. This helps to keep health insurance affordable for older and sick people who might otherwise be priced out of the market. Community rating is supported by providing cross-subsidies between insurers with different risk profiles. It is essentially a financial transfer mechanism whereby money flows from the insurers with healthier members to insurers with sicker members. This is called risk equalisation, and without it, an insurer with older or sicker members would be required to charge much higher premiums than their competitors to cover their claims costs. Risk equalisation seeks to level the playing field and encourage insurers to compete on what services they provide to their customers, rather than simply trying to attract younger people who are less likely to make health insurance claims. The risk equalisation scheme was introduced in Ireland in 2013. Under the scheme, credits are paid to all insurers for their older and sick members. These credits are funded directly by stamp duty levies on all health insurance contracts written. In effect, the scheme redistributes funds between insurers to meet some of the additional costs of insuring older and sicker members. None of the stamp duties on each health insurance contract go to the Exchequer. They are all redistributed to compensate for the additional cost of insuring older and less healthy people. In 2017, the Risk Equalisation Fund redistributed around 650 million of premiums, out of a total of 2.5 billion in premiums paid. The scheme is carefully monitored to ensure that none of the insurers are overcompensated, which would contravene the scheme's approval under the European Union state aid regulations. In this way, the cost of insurance is shared between all insured people, and we can ensure that sicker and older people retain access to affordable private health insurance. Legislation is needed each year to update the amounts of credits paid to insurers under the scheme and the amounts of stamp duty levied on health insurance contracts to fund the credits. As part of the process, the independent market regulator, the Health Insurance Authority, carries out an annual evaluation of the market, focused on the claims costs that every insurer has paid over the year. Based on that analysis, the authority recommends the level of credit that should apply the next year. The rates for next year, recommended by the authority, have been considered and accepted by my colleague, the Minister for Health, Simon Harris. This year's bill will provide for a general decrease in the credits across genders and age groups, and there will be no change in the stamp duty levy on contracts. Maintaining the stamp duty levies at existing levels should ensure that health insurers do not increase premiums and that contracts remain at an affordable price for all of our citizens. In addition to the technical amendments, this year's bill provides for a number of amendments to the acts governing the Health Insurance Authority and the VHI. In short, it is proposed to extend the membership of the Health Insurance Authority Board, to broaden the composition of the VHI Board and to enable the VHI to sell international healthcare plans directly. I will outline each of these proposed changes in turn. The Health Insurance Authority was established in 2001 with the provision for 5 board members to be appointed. Since that time, the health insurance market has become more complex, with insurers adopting an innovative marketing and product propositions to expand their client base and improve their risk profile. Further significant changes can be expected as the Sláinte Care programme is implemented. The role of the private health insurance in our health system could change significantly, and the regulator must be able to react to this changing role and to advise the Minister for Health appropriately. Public sector governance obligations have also become more prescriptive. The 2016 Code of Practice for the governments of state bodies placed much greater emphasis on the accountability of state boards. For the objective and effective discharge of its functions, it is desirable that the authority includes a broad mix of skills and experience, and expanding the membership of the board will ensure that they can deliver their strategy and address any challenges that they meet. The bill also contains 2 amendments to the Voluntary Health Insurance Act, which are governing the legislation for the VHI. The first VHI-related amendment deals with board composition. Currently, the VHI board is restricted to having only 2 persons who are health service providers on the board. This amendment will remove this restriction and includes a new provision that the Minister will give due consideration to the mix of skills present on the VHI board when making appointments, thus ensure the highest standard of governance. The second amendment to the Voluntary Health Insurance Act deals with one specific area of the VHI's business activities. This amendment will permit the VHI to sell international healthcare plans directly, not only as an agent, as they are allowed to do currently, and it will remove the requirement for VHI to seek ministerial approval before selling these plans. This development is consistent with the VHI's current status as an insurer authorised by the Central Bank. VHI is competing in a highly competitive and regulated marketplace, and this amendment will remove the impediment to VHI's ability to compete with its competitors and thereby allow VHI to avail of potentially significant business opportunities. I will now outline the specific sections of the bill. Section 1 defines the Principal Act of the Health Insurance Act 1994. Section 2 amends Section 11C of the Principal Act to provide for the 1st of April 2019 as the effective date for revised credits payable from the Risk Equalisation Fund. Section 3 amends Schedule 1 of the Principal Act to provide for the expansion of membership of the Board of the Health Insurance Authority from 5 to 7 and to provide for an increase in the quorum from 3 to 4. Section 4 replaces Table 2 and Schedule 4 to the Principal Act with effect from the 1st of April 2019, whereby the applicable risk equalisation credits are payable from the Risk Equalisation Fund in respect of certain classes of insured persons are revised. Section 5 amends Section 4 of the Voluntary Health Insurance Amendment Act 1996 to provide for a change in the composition of the VHI Board. This amendment will remove the existing restriction on the number of healthcare providers on the VHI board and includes a new provision that the Minister will give due consideration to the mix of skills present on the VHI board when making appointments, thus ensuring the highest standards of governance. Section 6 amends Section 1 of the Voluntary Health Insurance Amendment Act 1998 to amend the VHI's current function as solely an agent for the provision of international healthcare plans to permit the VHI to sell international plans directly without an intermediary. The amendment will also remove the requirement for VHI to seek ministerial approval before selling these plans. Section 7 amends Section 125A of the Stamp Duties Consolidation Act 1999 to specify the applicable stamp duty for rates 1st of April 2018 to the 31st of March 2019, and secondly from the 1st of April 2019 onwards. Section 8 provides for the shortle title commencement, collective citation and the construction of the bill. As I have said at Carlock, this bill allows us to maintain our support for the core principle of community rating, which is long established and well-supported government policy for the health insurance market, and the amendments to the legislation governing the Health Insurance Authority and the VHI are to allow these organisations plan for future developments in this ever-changing and complex environment. I commend this bill to the House of Carlock. Thank you.
Thank you, Minister.